I am Professor Dr. Vivek Gupta, and it's my big privilege on 23rd of May 2022 on Monday afternoon or evening. I am in Rouen in France in Hospital Charles de Gaulle, where I have done the initial training, and whatever today I am is because of Professor Alain Cribier, who does not need any introduction, but still I would like to introduce him. He is one of the most eminent cardiologists of the world. He belongs to France in Charles de Gaulle Hospital in Rouen, which is in Normandy, which is about 130 kilometers from Paris. He has trained not less than 1,000 doctors from India and other places of the world. He is the innovator and inventor of many things. Most important is transcatheter aortic valve implantation, and most important thing which I would like to share today is, because of the blessings of God, I share a very special relationship. Maybe in the previous years of my life we were together somewhere else, and he has a lot of regard for me and I have much more regard for him. So Dr. Cribier, I wanted to know, before you introduce a little more about what I have said, and also I wanted to know, we have celebrated 20 years of TAVI on this Saturday. TAVI means transcatheter aortic valve implantation, which is a non-surgical technique for replacement or changing or putting another new valve in a aortic valve stenosis, which is getting very common not only in France and Europe and America, but also in India. So please tell us a little about your story and about the TAVI.
Well, it's a long story, I have to be short, but actually I developed this technique because many patients could not be operated on for having a surgical valve replacement and were dying of their disease. And the only possibility to save their life was to introduce a valve using percutaneous approach and with only local anesthesia and through the femoral artery. So it was a much simpler procedure than opening the chest and doing heavy surgery. So I developed this procedure. It was 15 years of research. It was a very long time.
15 years of research. 15 years of research. This is very important.
Yeah.
His passion for the valve is there. He's not only a valve person, he has done a lot of angioplasties. In fact, whatever I have learned of angioplasty, which I do in Apollo Delhi as a complex angioplasty, is because of him.
Yes, well, actually, I started to work on this subject in 85, so it's a long time ago. I started to introduce in the world the technique of balloon aortic valvuloplasty, consisting in dilating the valve only with a plain balloon and trying to improve the situation of the patients. And then there was some kind of restenosis, early restenosis, and I started with the idea of replacing the aortic valve using a transfemoral approach percutaneously, with the introduction of the catheter through the skin at the groin level under local anesthesia alone. And so everybody thought that it was totally insane, to try to do something like this. And it worked out very well. And I did the first patient exactly 20 years ago on 16th of April 2002. And then I did the first series of patients here in Rouen. We had a 50-patient story of all the patients were dying. They were rejected by the surgeon. They were turned down for cardiac surgery, and we did the valve with a tremendous success, with a clinical improvement, unbelievable clinical improvement. And then the technique started to spread in the world, and today we are reaching now 1.5 million of patients done in more than 80 countries of the world, and this is a technique which is done in routine everywhere. So I am very proud of this, and we celebrated the first 20 years anniversary of the first patient last Saturday on the 21st of May, and it was a great ceremony with people coming from the whole world, and we had a number of people, who were there almost crying, to say when celebrating this anniversary. So it was a great thing, and I am glad that you could attend also this ceremony.
Yeah, for the public also, I would like to tell you that this is actually putting a valve without opening the chest. This is transcatheter aortic valve. A lot of physicians even do not know in India. This is going to about 5 lakhs people all over India, and this technique is invented, innovated, hypothesized, planned, animal experimentation, and then first in man in 2002. In India, we have started doing this procedure, but not to that extent. But it's my privilege that I'm standing with him. One thing more I wanted to ask you, Professor Alain Cribier, or I can say Alain, you'd like a friend. What is any other innovation which is coming to your mind? Because you had something like percutaneous bypass. That means...
yes, well, actually I had some ideas, but I didn't have enough time to do that. But I developed a mitral commissurotome. It was another instrument, to treat another valve disease, which is very common in India, mitral stenosis, and I am very proud of having developed this device, which was working very well as well. So I did also a new coronary stent with Medtronic, and many things, but nothing to the level of percutaneous aortic valve implantation, because this is really a revolution, and it has revolutionized the concept of treatment of valvular disease in the whole world. So this is something very great, and I am very, very satisfied of the result.
For the last thing which I want to tell you, that the French Society of Cardiology has already nominated him for the Nobel Award, and we hope and pray and take the blessings of God Almighty that soon he should be decorated with the Nobel Prize. And we all know that somebody who is nominated and who is deserving for the Nobel must be a very, very big man. So I always tell all my people and my family and my parents and my God blessing that I had the privilege to work with him when I was 30-year-old, 29. Then I came to him, worked in this hospital. And of course, he was already a big man because he did the first aortic valve balloon dilatation in 1985, published in Lancet, and the whole world was looking at him. Whosoever the best cardiologist of the whole world, they came to Rouen to see how it performs that innovative technique, and he was already a celebrated person, but he became more celebrity because of transcatheter aortic valve implantation.
Yes, thank you very much, Vivek. Thank you.
I really appreciate your love, affection,
Thank you.
And you have to come to cut the ribbon of our proposed Indo-European Medical College.
We have to believe in dreams,
Of course, but we have to keep trying. We will have it.
Sure, okay.
Thank you so much.
Okay, thank
Thank
you. Thank you.